here is our host, Tian Wei.
Hello and welcome to The Frontline, a World Insight special on COVID-19 coming to you live on CGTN. I'm Tian Wei. Amid the pandemic, we are inviting medical workers, researchers, and health experts who are working on the very front lines in China and around the world to help us understand what's going on. Today, we are joined by 5 of them. They are, in Wuhan, Dr. Cao Wei, a physician of infectious diseases at Peking Union Medical College Hospital. Also in Wuhan, Dr. Wu Dong, an associate professor of gastroenterology at Peking Union Medical College Hospital. In Avalon, New Jersey, in the U.S., we have Paul Offit, a professor of vaccinology from the University of Pennsylvania. In Seoul, South Korea, we have Dr. Alice Han Kyang-tan, an internist at Ms. Medi Women's Hospital. And in Rome, Giovanni Rezza, the director of the Infectious Disease Department at the Italian National Institute of Health. And first, let's talk to the 2 Chinese doctors joining us from the epicenter of the outbreak in China, in Wuhan, Dr. Cao Wei and Dr. Wu Dong. Thank you for joining us. My first question is about the latest situation. This week, already reporting 0 new confirmed case. Of course, things could change for the future, but what do you make of the latest development?
Well, I think this is a very good signal, which means that we have brought the situation largely under control. But we are still watching very carefully about those probably some new cases and the imported cases. I think that this is not time to relax to say that we have already got the victory. So we still need to work very hard to own this. And
Dr. Cao, same to you. If you look at the chart of how things have been developing from the very beginning of the outbreak until now, what is now in your mind since you've been in Wuhan already from February?
I agree with Dr. Wu that this has demonstrated that our measures are very effective of the prevention and control and also the treatment of the patients. But we still have to wait for about 1 month, which is actually twice the average incubation time, the longest 14 days, to see how things goes. And if after 1 month the situation will be relatively stable, then we can have the final conclusion that the epidemic in China, in Wuhan and Hubei, are almost done.
I want to ask both of you a question because 4,000 of those who are going to Wuhan and supported Wuhan during this process have already left. I mean, the medical workers from all over China. You talk about 1 month at least, but what's likely to be your division of labor between you and also the local medical staff?
Well, we are very glad to see some of our colleagues already left Wuhan. But since we are working in the ICU, we are taking care of patients who are very sick. And we know that we still have over 2,000 of patients of severe cases. So we're still, we're going to stay in Wuhan, probably to the last moment to take care of those severe patients.
Well, talking about those 2,000, it's likely that it's going to last a very long time. So Dr. Cao, are you ready for that? And what do you consider as likely to be the largest challenge as you proceed with the next month?
I think this can be divided into 2 aspects. One is for those who have been already diagnosed with COVID-19. Although a lot of patients have been discharged from the hospital, still many things left for us to do. The first is to observe, is there any reappearance of the positivity of virus in this group of patients and how this will go. Although we won't worry a lot about the reappearance of viral infection. And secondly, all of these discharged patients, a large proportion of them, are associated with injury of lung and impairment of lung functions. So in the future, the rehabilitation of these patients would be a huge problem to those discharged patients.
I see, Dr. Wu. You know, many people wonder, from the current situation, though people have been discharged from the hospital, some of them will not be able to develop antibody. However, Wuhan is already trying to move on a little bit from the earlier total lockdown. So what does that mean? Are you nervous?
Actually, we have taken some actions toward this. We have divided all the hospitals in Wuhan into two types. One type is totally specialized to continue caring for these patients over COVID-19. And the other type will gradually restore the normal medical order, taking care of those patients without COVID-19, because all these patients have been waiting a long time for the order has been to be restored.
Mm-hmm. Well, thank you very much. You want to stay with us because later we're going to have your colleagues from the United States, from South Korea, and also from Italy. You're watching The Frontline, devoted to the fight against COVID-19 pandemic. Stay with us. We'll be right back. And this is The Frontline. I'm Tian Wei. We are still joined in Wuhan by Dr. Cao Wei and also by Dr. Wu Dong from the Peking Union Medical College Hospital. Meanwhile, in Avalon, New Jersey, via Skype from the U.S., Paul Offit, professor of vaccinology from the University of Pennsylvania. Professor, welcome to our program.
Thank you.
I want you to meet your two Chinese colleagues. One of the things I want to ask you first is about the difficulty of testing, which is still existing today in the United States. Tell me more about the latest development. What do you think is the solution?
Well, I think the solution is that we shouldn't have been in this predicament in the first place. We put everything in the hands of the Centers for Disease Control and Prevention, and we should have made it so that a number of groups, including companies, were involved in making and distributing these tests. I mean, South Korea had tested 150,000 people by the time we had only tested 500. So we didn't really know where this virus was and how it was being transmitted. So we got behind the eight ball very quickly.
Now, free of charge, that was supposed to be to every American a test for COVID-19. But the thing is not necessarily about the price all along. It's also about the speed, isn't it, Professor Offit?
Right, and access. I mean, it's where you have, for example, in South Korea, you would have drive-through facilities, and in New Rochelle, New York, they have these drive-through facilities which can facilitate this testing much more quickly. For the most part, it's haphazard, and sort of from the population standpoint, you'd like to know who has COVID-19 and who doesn't. On the other hand, from the individual standpoint, it really doesn't matter. It's not like we have a treatment for this virus. So if you have a respiratory infection, even a mild respiratory infection, you should stay home independent of whether it's caused by COVID-19 or not.
Well, I guess for now, let me go to your Chinese colleague, Dr. Cao. You are from the infectious disease department, so I'm sure you have a lot to exchange with Professor Offit, who is a vaccinologist and also have been working on the virus. Dr. Cao, tell me more about how is this virus going to have an impact on different age groups? We heard the mixed reports. Older people, now there are more about younger people too. Dr. Cao, what's your take?
Generally, all the population are vulnerable for this, to this virus because this is a brand new virus to the humankind. So no one is expected to have the immune activity against it. But from the data we have gained now, it seems that elderly people with multiple comorbidities are more prone to get serious infections, which means they are more prone to get critically ill compared to their young peers.
The reason I ask this question has a lot to do with whether appropriate tests can be applied to different age groups. So how did China do it? At the very beginning, I'm sure it's also a struggling process. How did China manage to eventually nail it down, the testing? Dr. Cao.
At first, because the shortage of resources, the testing was limited. But now, along with the strategies of prevention and control, almost all suspected patients or individuals are getting the tests. And the test results will come out in about 4 to 6 hours, which will be rapidly reflected. And combined with the chest X-rays and chest CT results, patients will soon be diagnosed or ruled out for the diagnosis COVID-19.
Let me go to Dr. Wu as well. I mean, I can't not have you just sit there because I love the questions for you, Dr. Wu. Earlier, it was some American physicians who have been talking about the need for multiple support. For example, it said in the U.S., they are calling for better support to hospital patients. Some say it is a big test for everyone, particularly for the U.S. healthcare system. A patient needs a bed and also respirator. And also, it says what folks may not appreciate is the patient also needs nursing, therapists, good hospital cleaning systems. This is the largest workforce crisis in our generation. Now, Dr. Wu, you've been working in ICU. I'm sure you know the situation very well. Maybe you want to exchange some notes with your American counterpart, Professor Offit, about that too. What's about in the ICU?
Yeah, I totally agree with you that well, the patient with COVID-19 not only needs some ventilation in severe cases, but also need a whole range of supportive care, including fluid, nutrition, probably antibiotics, and some patients with shock, they will need a large volume of fluid, and we call it vasopressin. So this is the whole thing we are talking about. This is not only about respirator. I mean, since we don't have Panacea here, we don't have any specific antiviral medication has been proved effective. Mm-hmm. So the patient will need a whole range of supportive care, which is very complex, will require huge medical resources to be used.
Mm. I still remember at the very beginning the struggling you went through. I mean, you and your colleagues together with many other medical workers in China in order to get it done. Professor Offit, when it comes to the United States, already have 2 months of preparation since the outbreak China has in Wuhan. Do you think things are getting better in terms of preparation now?
Finally, yes. I think we were very slow, actually, even though that we had a 2-month head start knowing what was going on in China. I think we were very slow to react. I think our administration tried to downplay the importance of this particular virus infection. I think they thought that it wouldn't be a big deal in the United States, and so we didn't get in place the kind of testing that would have helped. We didn't get in place, the kind of medical support in terms of ventilators and intensive care unit beds. I think that we could have done earlier. Now we're just trying to catch up. I think we're still in the log phase, if you will, still in the exponential growth phase. We've gone from 2 deaths on March the 2nd to more than 140 deaths now on March the 19th. So I think we're still dramatically increasing the number of cases of deaths here, and I think that we have a good idea of the number of deaths. I think we have no idea of the number of cases. I mean, it's reported to be roughly 7,000 or 8,000 cases. I'm sure it's dramatically more than that, but we don't know that because we just haven't had appropriate testing done.
How many beds do you think, Professor Offit, do you have any number with you that the U.S. hospitals will be able to provide, particularly for the severely ill patients? Now, I also heard that the U.S. Navy hospital ship have been moving in order to also save lives. Altogether, put together, would that be able to solve some of the problems, Professor Offit? Do we know?
I think so. I mean, we have in theory about 900,000 beds to take care of patients, and now there are ships both on the East Coast and West Coast that stand and ready. We'll see. We'll see whether or not we do have such a challenge to our healthcare system that we have an overflow in patients as compared to beds. We'll see. I mean, right now that isn't happening. I think right now we're, for the most part, being able to handle this, but we are in this log phase, this exponential growth phase of cases in this country, so we'll see.
Okay. I have a question coming from our viewers and also our web users who are posing their questions for this specific interaction. There is someone called John Stone Wenbua. I hope I pronounced his name right, on Facebook asking the question, COVID-19 is not an airborne disease, right? Then why are people wearing those face masks when they are not sick or treating a confirmed case? Please ask the experts. Can I pose that question to the three of you? Obviously, the U.S. approach for now is not wearing a mask. Professor Offit, is it as a result of not having masks, or it is a deliberate and important choice?
No, I think it is at least an airborne disease. There may also be a fecal-oral component to this as well, the same way that, say, norovirus is transmitted or poliovirus is transmitted. But it is at least airborne. And so for people who work in the hospital, I mean, we wear the N95 respirator to make sure that we don't acquire that virus or transmit that virus. The question is whether or not those rectangular surgical masks that people wear are an important way to stop transmission of the virus. And I think they provide, in some ways, a false sense of security, that people have mild or moderate respiratory infection, and they think they're going to stop the spread by wearing this rectangular mask, which lets in air both as you breathe in and out. I think that's a little dangerous.
Okay. Dr. Cao, you want to have a quick take on this?
Yeah, I agree that this is definitely an airborne virus, and wearing masks, especially in the healthcare center, will help to prevent the healthcare workers to getting the virus from the ill patients. At the beginning of the epidemic in China, especially in the city of Wuhan and the Hubei province, as the rate of infection is relatively high, and usually we know that the population in China is very crowded, so we will suggest people to use surgical masks, especially if they are in the room or in crowded areas, or talking with people in a very short distance, in a very narrow distance, to prevent the possible transmission from people to people. But nowadays, since the situation in China is improving, we now have a new version of the recommendation of mask wearing for the general population in China. Means that if you're in the park or outside the house, if there's not crowded people, you don't need to wear mask all the time, but you have to prepare for it. So just to carry a mask with you. But if you are in like restaurant or cinema or crowded areas, just to make sure that you wear masks with you to protect you from potential infections.
All right. Well, we're coming to the end of this section of our discussion. Thank you so much, Professor Paul Offit, coming from the University of Pennsylvania. Be safe with you and your family. Thank you. Really appreciate it. And Dr. Cao Wei and Dr. Wu Dong, you want to stay with us. You're watching The Frontline, devoted to the fight against COVID-19 pandemic. Stay with us. We'll be right back. Welcome back. You are still joined in Wuhan by Dr. Cao Wei and also Dr. Wu Dong from the Peking Union Medical College Hospital. I have some questions for you coming from our viewers. Sana Tasaduka, who is asking, if someone is suffering from COVID-19 mild symptom, which over-the-counter medicines are best for them? What if a patient is not showing serious symptoms? Shall we go to Dr. Wu, maybe, to help us understand on this issue?
Because the data show us the vast majority of the patients who are infected with COVID-19 are mild cases, which means that they only need some supportive care, such as water, and those medications help to reduce high temperature, and make sure that they can hydrate themselves and also have food and isolate with the family members.
Got it. A lot of questions coming from our viewers, so maybe we put them later and then for discussion with you. And now we are joined in Seoul from South Korea via Skype by Dr. Alice Hyun-Kyan-Tan, internist at Medi Women's Hospital. Dr. Tan, what a pleasure to see you once again. Obviously, things are getting better. However, there's a twist and turn in South Korea. In Seoul, things are getting a little bit serious. Tell me more about that.
Right, so we expected some ups and downs as we descended from our peak, but we have seen some increase in new cases, especially overnight. Most of these cases have been due to clusters that we saw in Seoul, in Daegu, and in a city called Seongnam. They've occurred in a telephone call center in Seoul, a church in Seongnam, and in a nursing home in Daegu. And I think this reflects the characteristic of the disease in that there's high levels of viral shedding that occur very early on in the disease. It's highly transmissible. We found, of course, now not just directly, but also indirectly, it's transmissible. And then we're also seeing an increased number of imported cases as Korean nationals who have been traveling abroad, especially in Europe, are coming back, and unfortunately some of them have been bringing COVID-19 with them. But the overall trend, as you said, is improvement. We've seen more and more cured cases being released from quarantine. We had about 400, but we do need to stay vigilant. We're nowhere near the end of the battle yet.
No, but import cases are very important these days, particularly for those who were already in the fire first, like China, like South Korea. Throw the same question to Dr. Wu also about that. What about the imported cases these days in China? Many are very concerned about this. We see even in Beijing and Shanghai the rise of those numbers. What do you take? What's your take?
Yeah, we have seen a transition here from the new cases from inside China transited to the new cases from outside China. We are seeing increasingly more patients with newly onset COVID-19 coming to China from abroad. I think that our government have taken some measures to take care of this problem.
How? Maybe that is the issue. Dr. Cao, as an infectious disease expert, what is the best way to do it without totally closing the border?
Actually, I think this is a choice of strategy which will also change along with time. Depending on what's our estimated numbers of imported cases in the future. Situations outside China is actually exaggerating, so that makes more and more people may want to transfer from abroad to China. That was a huge question in the next few months for China. For example, if from the estimated numbers of imported people, they are kept growing at the recent days. And I think the government are beginning to design different measures at major cities which there has international air flights. For example, to test people when they have arrived in China, and then to distribute them to different areas for isolation. And for those who already had symptoms, they will be transferred to separate areas. For example, in Beijing, the Xiaotangshan area that was used for the SARS season has been reused again, just to treat the patients or potential patients coming from abroad.
Yeah. What about for South Korea? The next 1 or 2 weeks, also the most crucial time, likely, to see the what to do with the resurgence?
Yes, very critical. In terms of the imported cases, however, what we've decided to do is implement special entry procedures for all entrants from every country. First, it was limited to 5 countries in Europe, and then all of Europe, and now we've decided anyone entering Korea has to go through special entry procedures, and that includes downloading a special self-diagnosis application onto their mobile phones before deboarding the plane. And through this application, each passenger over the next 14 days that they are in country will have to report their temperatures, I think twice a day, and also whether or not they have any symptoms. And so we're hoping that we'll be able to, as you said, we can't close our borders completely, but we're hoping that we can detect any additional imported cases through this innovative application that we've developed.
I want to ask the three of you, earlier we have asked that question to our American guest, but I guess for the three of you, probably is more appropriate because you are already, quote unquote, in the fire. The age groups, people thought about the earlier only elderly group, but now it seems that more and more young people are also in the ICUs. So what is likely to be the real picture? Do we have the real picture, statistically speaking? Dr. Tan, I go to you first, and then we go to Dr. Wu.
Yeah, about 30% of our total positive cases are in the age group between the 20 and 29 years. And I think this reflects just how active this age group is naturally, but also the high amount of viral shedding that they will produce, especially early on in the course of their disease. And so, yes, certainly we could see more patients in this younger age group. Fortunately, in terms of the mortalities, in Korea, almost every mortality has occurred in adults age 50 or greater, and they've all had other underlying medical conditions.
However, we have noticed in some of the other countries, Dr. Wu from China, that younger group are taking quite percentage in the ICUs when it comes to the patients. What's your take?
I think there's a certain proportion for those young patients also being admitted into the ICU. But if we look at the data of the mortality, you'll find that the mortality of those patients who are older than 70 or 8 years old, there will be 10% to 15%. But in those patients who are younger than 40, there will be only about 1 to 2%. So, I mean, the young patients are admitted to ICU does not necessarily mean that they will die in the ICU. But it also depends on the medical resources. If we have adequate, medical staff to taking care of those patients, and also as well as the ventilators and all the things, I think even though the young people are admitted to ICU, they still have larger chances to be discharged from the ICU and survive.
When earlier I was talking to the spokesperson of the World Health Organization, one of the few great examples he set for the rest of the world, he said, are China, South Korea, and Singapore. Now, tell me, what do you make of each other country's approach to fight against COVID-19? But at the same time, what is the strongest point of your own approach?
I should say there are two major points that I want to mention. The first is because of the systems and the characteristic of China, that we are able to use resources all over the country, and the government are using different measures and measures for prevention and control of the cases. The secondly is that after the broadening of the testing, especially for the viral testing over the country, the situation has been quickly and greatly improved over China. That means that if we can identify and find the potential patients or those who might get infection from these patients, the situations will soon stabilize. In terms of what we can learn from other countries, I will use Singapore, for example. I know one of the successful measures Singapore used was to tracing and track every potential infected patients and to find all those who can potentially get infected. This is also applicable in areas outside Hubei province, as it is not so applicable in Hubei at the first time, at the initial phase of this epidemic. But we can see that outside Hubei, once we have identified or find a patient, all the people who have been in close contact with this patient will be traced and tracked and will be kept under a close eye on it until 14 days later the alarm is relieved.
I would like to compliment Chinese people. I think it is their self-discipline and responsibility for the country that has been largely brought the pandemic under control. But I totally understand that every nation has their own situations, and they should find their own solutions to the problem. But I would say that for the general public, you need to change your behavior and be responsible for other people.
I see. Oh, certainly. Also, the world bear in mind that South Korea has been doing a great job in terms of testing as well after the first clusters of and then community outbreak. For now, I want to thank the three of you. You want to stay with us, Dr. Wu, Dr. Chao from China. Meanwhile, Dr. Tan from South Korea, really appreciate it. Thank you so much for joining us again. I'm sure we're going to keep in touch about this. Thank you, Dr. Tan.
Thank you for having me.
Thank you. You're watching World Insight, a special program, The Front Line, devoted to fight against COVID-19 pandemic. Stay with us. The Frontline, I'm Tian Wei. We're joined once again by Dr. Cao Wei and also Dr. Wu Dong, coming from the Peking Union Medical College Hospital. Some questions coming once again from our viewers. One is asking, hi everybody. The name is Delada Siddiq. My question is about a person who is vaccinated for COVID-19 and the virus is still inside his or her body, incubation period. What is the consequence? Thanks. We do not have anything yet, I think, in terms of vaccination against COVID-19, but I would like the two of you to handle that question.
That depends on what kind of vaccine you are developing. For the preventative or prophylactic vaccine, generally, the situation will not exist. Means that you have injected the vaccine and still have the vaccine in your body. That is not a successful prophylactic vaccine. But sometimes we'll be not successful in getting a prophylactic or complete prophylactic vaccine. There is a name called treating vaccine. Means that you can keep the virus controlled in your body. In that case, this might be possible.
I see.
But one thing I want to mention is that for those who have been acutely infected, especially for respiratory virus, there hasn't now been report that this virus can stay for a long term in human's body.
I see. Thank you very much for your answer. And now we are joined from Italy in Rome via Skype, Giovanni Rezza, Director of the Infectious Disease Department at the Italian National Institute of Health. Mr. Rezza, thank you so much. I know you are extremely busy because you are head of the Italian CDC. So tell me more about whether we are likely to see a peak, sir, very soon, according to some reports.
I mean, very difficult to say, because actually we already got a peak, reached the peak in the area that was initially affected, the area of Codogno, near Lodi, in the south of the region Lombardia. And now the things are going better there, because there were very stringent, very reactive measures. But in other area of the same region, like Bergamo or Brescia, the situation is quite bad at the moment. So, you know, we need to wait for at least another 2 weeks before seeing an effect of the measures that have been taken at the national level.
Yeah.
Probably we should reinforce also measures at the local level, because actually there's not a real red zone, but all Italy has been considered a sort of orange zone, applying social distancing measures and the reduction of human mobility.
Italians have been using a lot of different methods in order to make sure social distancing happens. For example, city lockdown in the Italian way.
Yeah.
An early lockdown has its apparent benefits, some have been saying. The city of Lodi, around 40 kilometers southeast of Milan, stands out as an example of how this can work compared to its neighboring cities, Bergamo. We see a flattering curve on the chart. Look at that. Doctors believe a quicker reach and reaction in Lodi is the big reason for its efficient containment. Now, Dr. Renza, is that the case? Social distancing lockdown really served the purpose?
Yeah, I think we learned a lot from the Chinese experience. Done in Wuhan and in Hubei, and we applied the red zone in near Lodi, and it was quite successful. The problem is that then the government decided to apply a sort of orange zone with social distancing in all the country without having new red zones near Bergamo and Brescia, where the incidence was quite high already, let's say, a couple of weeks ago. Maybe the measure should be reinforced there because we had to protect Milan. You know, that Milan has an increasing number of cases, but the number of cases is still relatively low compared to the denominator, to the total number of people living in Milan.
Yeah.
So we should do more to protect Milan. And with regard to the rest of Italy, social distancing measures, I hope will work, but they should be combined with contact tracing and more aggressive testing policies.
Dr. Wu, of course, China's Wuhan, where you are, and Dr. Cao is also have been experiencing lockdown for the past 2 months now. What is the best part in terms of this policy decision? What is the most important part of this lockdown that you think everybody should know?
I think the classical theory still applies here. It's about all kinds of infectious diseases. You have to think about 3 components of the disease: the source of the infection, the route of transmission, and the vulnerable population. So the research is very important, and also the medical care is also important. But I think what's much more important is to cut down the transmission of the virus. So the Chinese experience that we take some very strong decisions regarding to shut down the whole city. It's you can imagine that this is a very difficult decision to make, but when we look back, I think this is also the right decision that we have been made.
I see. I'm sure you 3 have a lot to exchange with one another because you are all in the fire and you all know what it takes, and it's just the different circumstances. Dr. Cao, do you have any specific question or interactions, points you want to have with Dr. Retta coming from Italy? Dr. Cao?
Actually, I have a question because, as Dr. Wu has said, the lockdown of the city can certainly cut the transmission route and also separate the yield from the relatively healthy patients. But another important thing to consider when to make the decision of lockdown is, do you have enough resources or medical resources inside the city of Wuhan, for example? Because all the patients are now relatively focused in Wuhan, and you need a lot of medical resources, devices, or medical care workers to work in Wuhan to save these people. I think that may be a huge problem for Italy right now.
Dr. Retta, you want to take that?
Yeah, first of all, I would like to thank you for your recommendation, and I really appreciated what China did in Wuhan and Hubei, because actually you did a very good containment strategy, and that is difficult to reply in other areas of the world, but we should try to do something like you did in Wuhan. With regard to the health facilities, I have to say that unfortunately for them, but fortunately, the region Lombardia has one of the best health systems in Europe and in the world. They have many very good hospitals, but they were under stress because many healthcare workers got infected, especially at the beginning of the outbreak, because they didn't recognize the coronavirus infection, just because we were in the middle of the peak of influenza cases. Now there are patients from Lombardia that are transferred, that are moved to other regions in order to give them the best possible care. And also there are doctors going to Lombardia in order to help and support the activities. And at the same time, they are constructing a new hospital, a COVID hospital in Milan. So they are trying to reconvert some of the hospitals into COVID hospital and to increase the number of intensive care units.
Of course, we also know that with your interaction and even beyond, that some of the Chinese doctors, experts are also in Italy working with the Italian colleagues on fight against the COVID-19. Before we go, I mean, all of you have been and now in the middle of devastating situations. Stress is extremely high. How would you deal with that, and how would you help one another to deal with that?
Yeah, I agree that this is a huge burden, especially for the medical workers. We are seeing the same situations here in Wuhan and Hubei, and I think the mental health mental health of the medical workers are very important for us to carry on our duties and tasks. So we actually have groups dividing between our medical teams to help each other out with this devastating feelings or desperate feelings. And also we have a psychiatric service team which has been located in our hospital and in Tongji hospitals here, try to helping our medical care workers, including the doctors and the nurses, to go out.
Dr. Wu, you're working daily in the ICU. I'm sure the situation very tense there.
Yeah, I think working in the ICU, specialized in COVID-19, could be very stressful because the mortality is kind of high and you are losing patients from time to time, and also you will be very tired, both physically and psychologically. So I recommend that each shift for every doctor should be no longer than 6 hours, and you should take very good rest and take good care of you. And I also want to take this opportunity to extend my personal warmest regards to my Italian colleagues. I think their courage and sacrifice have shown that the Italian people will finally prevail.
We heard many of the Italian people singing in their balcony, having their concerts every day. And we also heard from Bono having the song, Let Your Love Be Known, devoted to the Italians singing on their balconies.
Yes, there is isolation. You and me, we're still here. Yes, when we open our eyes, we will stare down the fear.
It's true, there are people singing on the balcony, in the balconies. I mean, terraces at 6 p.m. and singing songs and singing that we'll win this battle together. And I hope this will happen soon. At the same time, I want to thank all the Chinese colleagues that have been here and exchanging information of how to have care of the patients in intensive care units and about drugs to be used. Actually, we would like to see the results of the controlled trials that have been done in China.
Thank you so much. We're running out of time. We would love to have our conversation to continue in the future. Giovanni Rezza coming from Italy, Caowei Wudong from China, epicenter of the outbreak Wuhan. Really appreciate it. All the best. Be safe. And that is all we have for today. If you'd like to see more, try to find us, World Insight CGTN, into your search engine, or check out our YouTube channel. Follow us on Twitter, Facebook. I'm Tian Wei on behalf of the team. Thanks for watching. Bye for now.